So we'll have a little look now at signs that your baby is feeding effectively. And it's really important actually, because positioning is what we've just talked about, but now we're going to have a little look at attachment at the breast. So these are kind of two separate things. Positioning is the run up, attachment is the jump, okay? So we're looking, has that been a really effective positioning to get a good latch? So it's the way the baby holds the breast in the mouth, and it's really a sign as to whether they're having a good feed. So it's something that you need to understand what it looks like so that you can have a look for yourself when you're feeding. So this picture is quite nice because this is a comparative picture here. So we've got two contrasting pictures. So the first one is showing an effective attachment here, okay? So this is also what we call an asymmetrical latch. It's basically meaning your baby is off center. They aren't on the breast centrally, they're on slightly asymmetrically. They've taken in a little bit more of the lower portion of the breast down here into their mouth rather than just being on centrally. And the second picture here is showing, basically this is an ineffective attachment. So this is also called a symmetrical latch. So the other names are, for a good latch, effective latch, we've got the deep latch, we have an ineffective latch or a shallow latch. Basically the baby on this second picture hasn't got enough breast tissue in the mouth, and the nipple will be right at the front of the palate, on the hard bony tissue, rather than right at the back of the mouth like on that first picture, where it's not compressed, it's not being pinched, it's not rubbing up against anything hard. And this is really important. So some of the things that you can see here we'll run through in greater detail in a minute, but the baby's chin is really close on picture one. So you can see the baby's come in with the chin first. There's no gapping at all between the chin and the breast. It's indenting the breast. It's close and pushing in. And if you tried to get something between your baby's chin and your breast, you wouldn't be able to, because it's pressing in on the breast tissue. Your baby also has a really wide mouth whilst they're on the breast. On that first picture, the asymmetrical latch, this deep latch, the mouth is still quite wide because they've got a nice big mouthful of breast, and so they have to keep their mouth really wide. The nose is tipped back. Look, there's plenty of room for your baby to breathe when they're latched on in this way. On the second picture, you can see the baby's come at the breast from the wrong angle. We've almost come in nose first. The chin is pushed back. We've got a big gap between the chin and the breast. The baby's mouth is quite small. It's quite narrow. It doesn't have a big mouthful of breast tissue, so it's got a narrow latch. And likelihood is that would feel very tender. If your baby's feeding in this sort of symmetrical shallow latch, it feels really sore. So you will probably know just from how it feels that something's not quite right. And potentially if that carries on, I mean, it can happen in just one feed like this, but if you keep feeding with a position like that, then you probably will start to see soreness on your nipples as well. You may get some cracks or soreness, and it's really unpleasant, and it's just something then that is then, you know, around and bothering you during your feeds. With good positioning and good effective feeding, you will not get sore. It won't hurt you to feed. It should feel pain-free when your baby's feeding. So please do tell somebody if you're experiencing pain. So we'll just run through that quickly again now. So recognising effective attachment, we have the mouth is wide open, a nice big wide mouth. The chin is touching the breast. You could also say the chin is indenting the breast. The chin will be pushed up into that breast tissue. The cheeks, which we couldn't really see on the previous picture or this one here, but the baby's cheeks will have a lovely rounded appearance to them. And you know, there won't be any dimpling or indenting of the cheeks. The cheeks will stay full and rounded throughout the whole feed. There will be more areola visible. So this is that brown pigmented part of the breast. So this is the areola here. So this big round. When your baby's on the breast effectively, you will be able to see some above the top lip here. I'm just going to turn my camera on and off. I'll do that in a minute. So yes, you'll see more areola above the top lip, and that might look like a moustache. So we tend to say your baby has moustache and no beard. All right, so that's something for you to look out for. We have a lovely rhythmical suck and swallow pattern. So your baby will be sucking in kind of rhythmical deep sucks with swallows. We're going to look at the swallows shortly. We'll come back to that. But your baby will start off with one type of suck pattern, and it will change throughout the feed. Just going to... So, feeding is pain-free as well, which we've already mentioned. So the sucking pattern then. The suck-swallow pattern of a feed changes. So when your baby first goes onto the breast, they do lots of short, rapid sucks. So your baby will suck really, really quickly, but they're quite short and sharp. They're drawing the breast tissue back. They're stimulating the prolactin with the suckling. They're trying to get oxytocin, prolactin release throughout that feed, get that rush of milk with the oxytocin release. When the milk does flow, it's something called a letdown reflex. It means that your oxytocin release has happened, and that oxytocin hormone is acting on the breast tissue to help propel the milk out. So the little tiny muscle cells around the milk duct squeeze down, and you have a letdown of milk. When that happens, your baby's suck pattern will change. So it'll go from being the sort of rapid, short and sharp sucks to switching to deep, rhythmical sucks, okay? And they'll have little pauses, where they have a breather, and then they'll go again, and you will intermittently see swallows as well. So nice sort of suck pattern, deep, rhythmical with pauses. And that is the bulk of the feed really, this deep rhythmical suck pattern. When they're coming towards the end of the feed, they can tail off into what we call flutter sucks. So these little flutter sucks will just kind of happen. They're not a really kind of nutritional kind of suck, but they are still getting milk. And actually what happens when they're doing the flutter sucking is they're nicely stimulating the sort of fat globules within the breast to kind of pop out into the milk, and they get lovely rich fatty milk. So these three parts of the suck pattern are really, really good sign that your baby's had a nice full feed, and ideally you want to see these throughout your feeding. Hopefully this video will play. What we're seeing here is a baby who is effectively latched at the breast, and each time the baby throws their jaw down, one just there and there and there, the baby is swallowing. Okay, so most of the time when the letdown is in and the milk is flowing, you can hear swallows, you can hear your baby gulping. When the milk is just slightly slowing and your letdown's not there in such force, you might not be able to hear the swallows, but you can see them. So having a look down, can I see my baby's chin doing this deep thrust down, thrust? And this baby is having a really effective feed because they're swallowing on almost every suck. So every time they suck, they have milk in the mouth. And that's what you want to see, frequent swallows, lots and lots of swallows throughout the feed. If you're struggling to see swallows, or you're seeing swallows but they're really spaced out, meaning your baby's having to work quite hard per swallow, then let us know. Tell us that you're not really seeing your baby swallow breast milk. So like I said, you can often hear the swallows during the baby's feed, particularly when your letdown reflex is kicking in, but you can see them throughout as well. So that's a really important thing to be looking out for. So tummy sizes then. How big is your baby's tummy? How big is a newborn's stomach? So day one, the baby's tummy is tiny. It's around the size of a cherry. So it's like a small marble, a cherry, an olive, and it would be full after about 5 to 7 mils of milk. Now we know that colostrum is produced if a baby is feeding, because babies are far more effective at getting colostrum than we could ever be. They will possibly have about a 5 to 7 mil feed. So in the first 24 hours, remember, colostrum, nature's liquid gold, superfood, loaded, condensed, packed full of goodness, little kind of low volume feeds is what they're having, but it's just in perfect sync with the size of their tummy. Over the course of the next few days, obviously the milk supply will be going up and the baby's tummy will start to accommodate and grow to accommodate those increasing volumes. So by 1 week, your baby might be feeding, if we could measure on an estimate would be between 45 and 60 mils per feed. And their tummy is now roughly about the size of an apricot. And by 1 month it's grown again, and also your milk supply will have increased, and you will possibly be producing somewhere between 80 and 150 mils of breast milk per feed. So this is around 1 month of age. So how do you know that your baby's getting enough breast milk? Well, what goes in must come out. So your wet and dirty nappies are one of your best signs that your baby's getting enough milk, okay? And these change in the first 7 days to establish while your breast milk is coming in and your feeding's establishing. So do your baby's nappies. Day 1, you would just want to hopefully see about 1 of each, but don't worry if you have more, that's absolutely fine. And then day 2, you're looking at about 2 of each. And day 3, your wet nappies start to go up a little bit. So you will start to see increasing wet nappies from about day 3. And they increase, and the easiest way to remember this is 1 per day. So on day 3, you have 3 wet nappies. On day 4, 4 wet nappies. On day 5, 5 wet nappies. And on day 6, 6 wet nappies. And then roughly it'll be in and around 6 wet nappies every day from there on, okay? The poo is starting as meconium. It's dark, it's tar-like. I'll show you a picture of it on the next slide. It's sticky, and it lasts about 2 days normally. Usually by the 3rd day, the poo is starting to change colour. So it can have kind of a lighter, grainier appearance about it. It just has a different colour and a different texture. And that's a really good sign if you can see that your baby is starting to get that changing stool by about day 3. And then as your breast milk kind of pushes all of that meconium out, it becomes a very yellow, very loose poo. Okay, breastfed babies have a really runny poo, and it's normal. It's not diarrhea. It's not anything bad. It's perfectly normal if you're feeding breast milk for your baby to have a very loose poo. It's quite luminous in colour. It's very yellow, and it comes out in abundance, really. Now, what we ask is that you have at least 2 dirty nappies per day for the first, it's actually for the first 6 weeks as a minimum. Okay, so 2 dirty nappies per day, and they need to be about a £2 coin size, and that is your minimum. Most babies, particularly if they're breastfeeding, will poo more than 2. So more is fantastic and great, and don't worry about it. 2 is okay, don't worry about it. If your baby is producing less than 2, we want you to worry enough to tell us, okay? We don't want you to worry, but we need you to tell us. What we would do is we would probably need to have a little look at your feeding and just check it, just see if there's anything that could be a reason as to why your baby is potentially only producing less than 2 poos a day. And that's your rough guide on what goes in must come out. If you have any worries about wet and dirty nappies, please do get in touch with your midwife. So the other thing is your baby's behaviour. So this is before, during and after a feed. So how are they? Before they feed and after they feed, how are they doing? So keeping an eye out on that. Also the suck swallow, we've mentioned sucking, we've mentioned swallowing. So that suck swallow, how many times do they have to suck before you get a swallow is really important. And the minimum amount of feeds that you need to have in a 24-hour period is 8 to 12. Okay, so 8 being the minimum amount of times your baby needs to feed. But if they're feeding more than 8, then that's absolutely fine. And please, don't worry about that. That's very normal for a breastfed baby. How do you feel during a feed? Okay, is it comfortable for you to feed? Are you having any pain? What do your breasts feel like after? Do they still feel full? Are you having any blocked ducts? Does it feel lumpy? Does it feel bumpy? If there's anything that's not quite right after you've fed, please do let us know. The other sign that you really need to get used to checking for is also, what does your nipple look like when it comes out of your baby's mouth? Okay, it should look the same shape as when it went in. Okay, so what you don't want to see really is any kind of pinched appearance to the nipple. Does it look flattened? Does it have like a lipstick shape? Is it sort of got a slant down one side? If it has any misshaping after your baby is finished feeding, again, we probably just want to check that latch for you, that effective attachment, and just see if it does look okay. It could be that there's just a few tweaks that need to be made to make sure that your nipple is directed right the way back into the palate. And also we will weigh your baby for you. So usually the first weight takes place on the 5th day after the birth, and then we will re-weigh your baby following up from that around sort of day 10 to 14. And again, your health visitor will re-weigh your baby for you as well. So babies can take a little while to get back to their birth weight. It's very normal for babies to lose weight initially. They normally lose weight in the first couple of days. So when we weigh them at day 5, we pick up that they are below their birth weight. Please do not worry if your baby is below the birth weight, that is normal. What we would do is just work out how much below the birth weight they are, and see whether there is anything that we need to do to support your feeding if they've lost more weight than expected. But weight loss is normal. What we do want to see obviously is that your baby is gaining weight, and usually most babies are back to their birth weight by about 3 weeks after the birth. So these are your dirty nappies that we've mentioned. So we've said obviously meconium day 1 to 2, you're changing stool day 2 to 4, at least 2 soft runny poos a day from day it's from day 4, but definitely I'd be looking out for that for day 3 too. And that your baby will develop their individual peeing pattern by about 6 weeks, sometimes a little bit earlier, but really do keep your eye out for those 2 peeing nappies a day. Meconium is that top picture that looks very dark.